To experience the full benefit of joint replacement, physical therapy is a necessary part of the recovery process. Therapy can reduce swelling, decrease pain, improve balance, and develop endurance. New studies show that home-based therapy, compared to clinic-based therapy, may be more appropriate after hip or knee replacement. An average of 12 weeks, with 30 to 45 minutes set aside for therapy every day. Recovery after joint replacement is, on average, a 12-week process. The majority of patients are able to return to most of their activities of daily living within 4 to 6 weeks after surgery. This typically includes returning to work, driving, and other enjoyable activities. We understand that each patient is different, and recovery can vary, with some experiencing a shorter time frame and others slightly longer than this 4 to 6 week estimate. Warming up helps to prevent injury by getting the muscles ready for a workout. Typically, patients are advised to spend 5 to 10 minutes stretching before exercising. A heating pad or warm towel can be used to help relax the muscles in preparation for stretching. The following stretches can also be performed in between exercises to keep the muscles from tightening. A good stretching routine also helps to break up scar tissue that will form after your joint replacement. During the hamstring stretch, be sure to keep your toes pointed toward the ceiling. Start by using a step stool to prop your leg up and progress to a chair. The higher you raise the leg, the greater the stretch, and it may be better tolerated to gradually progress. Let pain guide the intensity of the stretch. In other words, stretch until a tolerable discomfort is experienced in the back of your thigh and calf. Additionally, make sure the knee remains unsupported to really get the maximal stretch of your hamstrings. The hamstrings stretch should be held for 30 consecutive seconds. Aim for 3 repetitions of stretching. The calf stretch can be performed in 2 ways. The first is using the wall, and the second is with the foot flat on the floor. During the calf stretch, be sure to keep your toes pointed forward and to keep your heel on the floor. Again, let pain guide the stretch until a tolerable discomfort is experienced in the back of calf and thigh. The calf stretch should be held for 30 consecutive seconds. Aim for 3 repetitions of stretching. This can be repeated on both legs. The quadriceps stretch usually takes the longest time to see improvement because of scar tissue. For a seated quadriceps stretch, take your knee and bend it back as far as it will go with a tolerable stretch. Remember to keep your foot flat on the floor and your back straight. Try to hold for 30 seconds. Next, take your opposite leg and use it to further bend your knee more to experience more of a stretch. Aim for 3 repetitions of stretching. This can be repeated on both legs.